that so we can hear it.
No problem.
No faces though, so.
Oh, no problem. All done. Everything we talked about, able to get it done. Okay.
How far up did we go?
Yeah, so I went up to my standard level, just a little bit, maybe a little bit higher than my standard level, but on the preliminary margin, negative, and the tumor was much lower because I asked them to specifically open his esophagus, and I could feel the tumor too, and I wanted to confirm that they could see it. It was much lower. So I have at minimum, several centimeters, 5-6 centimeters worth of margin there. So I think we're in good shape. I think I don't know why it looks so high up on that PET scan.
Could it be from that stent?
No, well, the first PET scan was definitely altered by that stent. I would say maybe not even trustworthy because of that stent. But the second PET scan for sure. With that stent out and after treatment, I could see clearly what the tumor was.
Mm-hmm.
So I'm very confident about the margin. I hooked him up back in his chest, took the necessary lymph nodes that are needed, and that's it. So now he's awake, he's doing well. So we will proceed with my algorithm, and I'll let you know if I have to deviate from my protocol.
Okay.
For some reason, he has severe COPD, and his pulmonary function tests were significantly abnormal, but he did fine, and his lungs look great. I don't know. He's not on oxygen, and outside of the hospital, and he did fine on the ventilator. He did fine with one lung deflated. So I don't. It just seems like he's fine.
It seems like God had a hand in it, huh?
Yeah, I don't know. He doesn't seem like he's ever had any symptoms from his COPD, but.
We know he has.
Yeah, then I'll use all of his COPD medications.
Sure.
And aggressive breathing. So.
Okay.
So that's where we stand right now. So what will happen is no major changes for 4 days.
Okay.
So Friday to Saturday.
When will you start feeding tube?
The feed's tomorrow.
As
long
soon
as
as
he's
tomorrow.
feeling okay, yeah, and it'll go at a very low rate. It will not be at the normal rate that you guys are doing at home.
Okay.
I will slowly titrate it up.
Will he be likely? Do you anticipate that he will be on solid food and that feeding tube will come out before he's released?
No, absolutely
Okay.
not. When he leaves this hospital, he'll be on a liquid diet. And most people that I do this in don't have a feeding tube. Well, when you do have a feeding tube, we might as well use it until your calories are up high. And if I see him back in clinic and he's doing well, and what I do is I see you every week until you're eating regular food. So leave the hospital on a liquid diet. Then I see you in a week and I get you on a soft diet. Then I see you in a week and then I put you on regular food. And at that point, we'll start taking the tube feeds down.
Okay.
But everything depends upon how he does. I need this whole connection to heal.
Oh, yes.
So it's got to be wide. It's watertight right now. I test everything. But in 4 days, what's it going to be like? In a week, what's it going to be like? That's what I wait for. So,
okay.
So at least with the liquid diet, I can ensure that there's an unnecessary stress on that.
Now, he'll be here for 10 days, you said?
No, usually at minimum a week. Some people get out in 6 days.
Oh, okay.
Some people, 5 days if they start pulling their own tubes out. Make sure he doesn't pull any of his own tubes out.
You're asking a lot.
But per my protocol, I mean, if you look at how I do everything day by day, it adds up to 7 days.
Okay.
So.
Okay. And then when you take the feeding tube out, is that another procedure where he has to go under? Or you just yank it out?
I just pull it out when he's in clinic, and that's it.
Okay. Yeah. The other tubes as well?
All of those other tubes I usually take out while he's here. So
even the chest ones?
Even the chest ones.
Okay.
Yeah. Very rarely do I send you home. I put a small tube also in the chest. Very rarely do I send you home with that. It just depends on how things go. Whole different story if this is not watertight. That's but per my protocol, all tubes and drains come out before discharge, except for the feeding tube.
Right. Okay.
So.
Okay. Do you have any questions? No.
So he'll be in the recovery room for a little bit longer, hour plus maybe. You'll see him up in his room. These guys will tell you which room he's going to.
Yeah. She told me come and check that out.
Yeah, so they'll let you know, and then you can go up and visit with them then.
So provided this is watertight and nothing changes, we're not looking at any more procedures.
No, I hope not. Goodness.
Me too.
Yeah.
But
One
yes.
Is long enough. Oh.
Okay.
Yeah.
All right.
And so at earliest on Tuesday, maybe you can start drinking something. But be very vigilant that he doesn't eat or drink anything for the next 4 days.
Oh, you better keep him here
it's
then.
It's gonna be painful for him. I know dry mouth and dry throat is extremely painful. Okay.
Okay.
But just do the best you can to have him bear with it. Okay. The most important things is that there's nothing to do in the hospital. So whatever you think he can do to stay busy, I want you to bring it to the hospital. Whether he likes to read, whether he likes to play on a computer, whether he likes to watch certain movies or whatnot, please make sure that he is occupied while he's here. Okay. Or else things start to get very confusing for the patient. And I know it sounds crazy. He's a young, healthy guy, but before you know it, if you're in the room for so long, you won't know what day it is. You won't know what happened to you. He won't recognize you. And so these things creep up easily. Okay.
Okay.
So when you're here with him and you guys are keeping him company, try to take some shifts. Depending upon your availability, so he has somebody to talk to. Make sure you bring by whatever he likes to do to keep himself busy. Make sure you always encourage him to do deep breathing and coughing. There's going to be a machine in the room that he will be working with aggressively.
Yeah, you said once every hour he has to.
10 times an hour.
Yeah.
While he's awake, 10 times an hour, and the nurses will show him how to do it. And I'll watch him every once in a while too, and give some feedback, but it'll keep the lungs open. Okay. So we need to do all of those things and work aggressively with our physical therapist and walk and sit in a chair. Keep the blinds up during the day. Let the sun come in. When the sun comes up, get him awake, get the blinds up, and then don't put the blinds down until the sun goes back down. Okay?
Okay.
I'm okay with naps during the day. There's not much to do here, but make sure it's not for like 4 hours.
Okay.
Make sure he doesn't go to sleep for like 2-4 hours, because then he's going to be awake at night and everything is going to get mixed up. So I need him to get a little bit tired during the day with activity so he can get good rest at night.
Okay. When you were saying don't drink anything, are they going to be giving him the little sponge swabs?
He can have sponge swabs just for the lips. I don't want anything inside the mouth.
So don't let him, if they give it to him, keep him from sucking on it?
Yeah, if he does, not the end of the world. It's not going to do anything, but what happens is that it's a slippery slope. You put it in the mouth and now all of a sudden, before you know it, you're eating ice chips. Or you're drinking from that cup that the sponges are sitting in. I've seen it all the time. Even I wouldn't be even able to do it. Think about it. 4 days with that kind of dry mouth, man. If you put a cup of water in front of me, I would chug that in a second.
Right. So that's why I'm clarifying, because he's very persuasive and he gets nurses to do things that they ought not do.
Then don't even have the swabs in there. You just use some Vaseline or something to moisten. Or use a little bit of water on the finger to moisten and put some Vaseline.
Well, I know they always bring him chapstick. They always bring him chapstick.
Use chapstick. So. Yeah, it's gonna hurt him. I know. It's painful.
It's gonna hurt. Okay.
It's painful, and I don't have any good solution for that except to just wait it out and keep him busy.
When do you usually take the epidural?
The epidural, I usually take it out once he's able to have pills, or else I won't have very good pain.
So he'll have it for sure for 4 days.
At minimum 5 days.
A minimum 5. Okay.
And the reason is because I don't take that big tube out of his chest until about the 5th day. Okay. So on the 4th day we test everything, and I start him on liquids. As long as I don't see anything suspicious in that big tube, I take that out on the 5th day, and that's what causes a lot of pain. So once that big tube is out, now we can safely take the epidural out, give him pills for pain control, and he should feel much better.
Okay. Yeah. I just know these are questions he'll have.
No worries. I'll go over everything with him one day at a time. The only unusual thing is that it's Friday. I won't be here Saturday, Sunday, but it's okay. My partners are here.
Right.
They know my protocol. I've already talked to them. You'll meet him. You'll like him. His name is Dr. Buddha. So he'll be here Saturday, Sunday.
Okay.
And it's pretty simple. No big changes. If there's any issues that require major intervention, going back to the operating room, or something that will I'll be here. Okay.
Right.
And me and Dr. Buddha will work together to solve the problem, but there's no big changes on Saturday, Sunday, because everything happens on Tuesday, 4 days after surgery.
Right. Okay.
So, but you'll meet him, you'll like him, and other than that, just keep him busy. Okay.
Keep him busy.
Because I don't know much about what he does on his downtime. I like to. The analogy I always use is if you're at some sort of a bus stop or an airport or something. What do you do when you're just waiting? That's what it's going to be like while you're here. So bring something in.
He talks.
Then if you guys are able to, he needs somebody to talk to then.
Okay.
Or he needs his phone there, ready and charged.
FaceTime.
It needs to be charged so he can FaceTime and he can talk to you guys.
And I have the charger and all of that ready.
But remember, talking a lot is going to create even a drier mouth.
Right. That's why I was concerned with.
So just see.
I was like, he likes to talk, and I don't see him wanting
if
to
it
talk.
becomes really bad, I mean, if we're talking that he is just in agony, then I'm gonna have to make. I'll change my protocol. I can't have him in agony.
Right.
So. Yeah,
Okay.
I mean, if it's to the point where he'll do anything to put some in his water, and his behavior is getting a little bit strange, I'll change my protocol. I'll make some changes, and I'll let you know.
Okay. I anticipate that.
I do too.
Let's
knowing,
see.
knowing him the way we know him, yeah.
Let's see. Who
Yeah.
knows? He's done everything I've asked him up until now, so I don't see why not.
Mostly.
He's done a great job.
He's fudged here and there, but mostly.
He's made it to the operating room. He did
Yes.
everything I wanted. And
Yes.
He did it. So he might have done maybe a little bit of complaining here and there, but I don't. He'll be a little bit of complaining over the next 4 days too. We'll be
Oh,
able to-
sure.
Yeah.
And that's why he gets to stay here and I can walk away.
Yeah. He has the right to complain. We've done major things to his body.
Right.
And I feel for him.
That, yeah,
His whole anatomy has
major
changed.
things
Yeah.
too.
Yes.
So he has every right in the world, and we'll do the best we can to make him feel good.
Okay.
Yeah.
When, I know this is way in the future, but when you were talking about, what you're doing to his stomach and
Yeah.
stuff, it made me think of lap band surgery and stuff. When he gets to where he is eating,
Mhm.
is it so much more important for him than the average person to really monitor how much is getting in that stomach,
Well, we'll
or
see.
does it matter?
No, so what happens is that usually you take about 6 plus snacks, small meals in a day for even up to a couple of months after surgery. You
Mhm.
guys really need to pre-plan his meals so
Right.
that things aren't spontaneous. Because if it's spontaneous, he'll forget to eat. You're gonna have major weight loss. The thing about him though is that we have the feeding tube, so
Right.
you always have a backup
He
plan. But
won't forget to eat. I'm afraid of overeating.
if he overeats, he's gonna throw up. He's not gonna feel good. He's gonna have chest pain. Things are gonna get dilated. He's not gonna feel good.
Okay.
Yeah, so he cannot overeat. It will not feel good. It needs to
Okay.
be portion control, small meals, 6 meals a day with some snacks in between. So if you think about it, your whole day for the next at least 6+ weeks is gonna be meal planning. So if you can stay 1 week ahead every time that the meal's made, prepared, planned out, no additional thinking has to be done, you're gonna have wastage of food. He's not gonna be able to eat everything you put in front of him. So
Sure.
make sure they're small portions, and he's gonna get bored with it. We don't normally plan every single meal, right? But,
Oh yeah.
but do it. Do it
Right,
for
right.
the next couple of weeks so that we're in good shape, and then he can go back to spontaneous eating, and eventually he should be eating 3 meals a day. That's what most of my patients are.
Oh,
They're
okay.
eating 3 meals a day, maybe a little bit smaller. Everybody has weight loss, and then they even out.
Okay.
And so he'll find a new weight for him.
Okay. You have any other questions?
I didn't have any.
Well, I meant other than what I asked, not
No.
like other from you.
I'm like,
Well,
You?
he'll be in the recovery room. Go and visit with him in about an hour or so. I'll make him feel good. And if you have any concerns about his care, just let the nurses know. They'll give me a call.
Okay.
All right,
Okay.
guys.
And we see Dr. Sue December 1st.
No problem. Okay.
Is that to evaluate whether he needs immunotherapy?
I think he's going to need immunotherapy. The only
Okay.
reason not to have immunotherapy is if there's a completely destroyed tumor there.
And
That
it
means
wasn't
no-
completely destroyed.
Well, and so I could feel something. And
Yeah.
number 2, remember it lit up on the PET scan.
Yes.
I don't
Right.
anticipate it being completely gone, but we know he had a tremendous response because he was able to eat.
Yes. Yes.
But I think he had a response. But if there isn't 100% response, we typically give immunotherapy.
Okay.
But Dr. Sue will go. He's the expert on that end. I'm
Right.
speaking on his behalf, but he'll go
Right.
over that in detail with you guys.
Yeah. No, I was just curious if that was to evaluate whether he needed it or if it was more like we're going to get started on this and this is
You
what that
probably
looks
won't
like.
get started that soon. I mean, it depends. You could. Immunotherapy shouldn't have any significant effect on the healing, but typically we start any sort of therapy about a month, 6 weeks to 8 weeks after surgery.
Okay.
So, but he'll probably want to see how you're doing and then start
Oh,
planning
sure.
ahead.
Right. Okay. All right.
All right, guys. Well, we let the nurses know if you need anything, they'll give me a call.
All right.
Okay.
Thank
All
you.
right. You're welcome. So once again, you have a little bit of time. So you have time to eat, and then just make sure you know which room you're going to, and you can head on up there.
Okay.
All right, guys.